Hi Year 11s, Miss Portelli here. Today's video is going to be focusing on particular malfunctions in our blood glucose regulation mechanisms. Those malfunctions that we do need to focus on are type 1 diabetes and hypoglycemia, as they are the two that have been outlined in your study design dot point. So let's take a look at hypoglycemia. Hypoglycemia is the blood glucose regulation mechanism that's been specified in your study design, but we are also going to talk about hyperglycemia because the two of them kind of go hand in hand. So when we are looking at these words here or these terms, really we're using them to describe the extremes of our blood glucose levels. So if we are using the word hypoglycemia, we're actually referring to someone who does not have enough glucose in their bloodstream. Hyperglycemia is the opposite. Oh, you guys can't really see that red on the pink. Let me swap that to a green. So the hyperglycemia is referring to too much glucose in your bloodstream. Now I just want you guys to pause and think for a minute there. We've heard those prefixes hypo and hyper previously in our study design this year. So we've referred to hypo when we talk about hypotonic solutions, and we've also used the prefix hyper when we're talking about hypertonic solutions. Okay, so I guess if you're familiar with those terms when we were talking about water concentrations in a hypo or hypertonic solution, you can use that knowledge and understanding to help you remember or to understand what's happening with someone who's got hypoglycemia or someone who's got hyperglycemia. So if you remember back, hypo, we used that word to refer to something that had a very high water concentration and a very low solute concentration. So we can then apply that to our blood glucose levels. So if we've got a very high water concentration in our in our bloodstream, that means that the number of glucose molecules in our bloodstream is going to be quite low, the glucose being the solute in that situation. So we're still using the same prefix to help us explain that. So if we look at this image here, this first little blood vessel that's being shown, we can see that there are 4 different red blood cells in there, and we've got 1 molecule of glucose here in white in the middle. So that's trying to show us that there's not a very high solute concentration, or specifically glucose concentration. So it's a very low glucose concentration or low blood sugar, and that would cause someone to experience hypoglycemia. And we can see the signs and symptoms of hypoglycemia on the left-hand side of this image here. Okay, so you're quite tired, hungry, irritable, all sorts of things that sort of go with thinking about not having enough glucose in your bloodstream, which obviously then has the side effect of your cells not being able to access enough glucose to make energy also. If we then look at the flip side where we're looking at hyperglycemia, so when we talked about hypertonic, we were talking about a solution that had a very high solute concentration and a very low water concentration. This is kind of what's happening in your bloodstream as well. So remember, those solutes we're referring to are the glucose molecules in this example. So someone with hyperglycemia is going to have an extremely high level of glucose molecules compared to normal in their bloodstream. And those glucose molecules are being represented again by those little white circles in the diagram. So we can see there's heaps more of them in this picture, and that's indicating that someone's got a really, really high blood glucose levels. Okay, so someone who's got high blood glucose levels would experience the symptoms that are outlined in the right-hand side of the diagram here. And this is often associated with things like being really thirsty or having to go to the toilet quite a bit. Obviously, if you're going to the toilet quite a bit, it's because you're thirsty, okay? And if you think about that logically, the reason you're so thirsty is your body is trying to naturally dilute the amount of glucose that is in your bloodstream by adding more water to your blood. So just to quickly recap, the hypoglycemia, that is the one that is mentioned in your study design. You must know about this. So having not enough glucose in your bloodstream. And a lot of the time, some diabetics can experience hypoglycemia where they don't have enough glucose in their bloodstream. Hyperglycemia, it would be really good if you guys know about it, but it's not a must to understand that one as it's not specified in your study design. And finally, let's have a look at what can go wrong with our blood glucose homeostatic mechanisms. So here we have an image on the screen that is showing you, I guess, typically what would happen in a healthy human. So our pancreas here, the yellow organ is the pancreas, is producing our insulin molecule here in blue. And we can see that the insulin molecule is now interacting with a receptor on the outside of a cell. Okay, that insulin molecule opens up our gateway or our protein channel here on the cell membrane to allow the glucose molecule to enter. So this is what would typically happen in a healthy human if they had too much glucose floating around in their bloodstream. So their blood glucose levels were a little bit high. We can then have a scenario or something that we term as type 1 diabetes, where in type 1 diabetes, an individual isn't able to produce insulin from their pancreas, okay? So their pancreas isn't producing that insulin molecule that would have been here in the diagram. It's not there anymore, which means that if we look over to the receptor here, we can see that the receptor actually isn't interacting with an insulin molecule. So if the cell doesn't receive that signal from the insulin molecule, that protein channel over here that was meant to open to allow the glucose to enter the cell, it never receives the signal to open. And that glucose doesn't cross our plasma membrane to enter the cell. It's stuck in our bloodstream. So people who have type 1 diabetes tend to have a very high level, a very high blood glucose level naturally, because their cells are not absorbing that glucose as easily as someone who wasn't suffering from type 1 diabetes would. Obviously, the treatment for someone with type 1 diabetes, as most of you are probably aware, is that particular person is required to take daily injections of insulin. So we artificially harvest this hormone insulin, provide it to them in a dose that they can inject through their skin, and that's providing them with the hormone that their body should be creating, but it's not creating for whatever reason. And that insulin is then able to interact with the receptors on their cell and allow them to absorb the glucose. All right, and I know this one isn't part of your study design, but I know you're probably going to ask the question, so I thought I'd include it anyway. Type 2 diabetes. So this is different to type 1 diabetes. Like I said, it's not on your study design, but if you want to know about it, keep listening. If you don't, feel free to stop the video. It's your choice. So type 2 diabetes, this is the type of diabetes that most people develop later on in life, and it's usually caused by like your lifestyle choices, not necessarily something that you inherit. Whereas the type 1 diabetes that we were talking about before, you're usually born with this or you've inherited this disorder. It's because there has been a malfunction in the expression of your genes, not because of something that you're doing in your life. So type 2 diabetes, these individuals can actually still produce insulin. So if you look at the diagram, they are still producing those insulin molecules here. The difference is that for whatever reason, those insulin molecules fail to interact correctly with the receptor. So that might be that they are a different shape to the receptor. Maybe the receptor has changed its shape and no longer fits the size of the insulin molecule. Whatever it is that's causing it, the insulin molecules are still there. They're just not triggering the cell. And if they don't trigger the cell isn't going to open up those protein channels to allow the glucose to enter. So again, we get that glucose being stuck in the bloodstream, which is not ideal. So this one can sometimes be treated with insulin injections, but most of the time treatment for type 2 diabetes revolves around your lifestyle choices, so a change in diet and exercise, that sort of thing. And depending on how severe your condition is, that will, I guess, impact how significant those changes in your life need to be. But hopefully with the right intervention, it's something that patients can manage, and it is possible to recover from type 2 diabetes. Whereas type 1 diabetes, the first type that we were looking at where you can't produce insulin at all, that one you have for life. That there's no known cure to that one at the moment, even though scientists are still to this day trying to find one.